Okay, welcome to my presentation of my practicum at SHOAL Centre in Sydney, BC. I would like to acknowledge that the land on which I live on and which the SHOAL Centre is situated is on the unceded traditional territory of the Wasanich peoples. My area of focus in the BA program is aging. My interest lies in making it possible for older adults to age comfortably and safely within their capabilities and despite their limitations. SHOAL Centre offers many programs that address such issues. SHOAL is an acronym for Sydney Health Options for Active Living. It is operated by Beacon Community Services, whose mission is helping people, improving lives, and its vision is healthy, mobilized communities where people's needs are met. The Activity Center offers many amenities such as crafts and ceramics, pottery rooms, a games and card room, a woodworking shop, a billiards room, lapidary and silversmith shops, billiards room, and meeting and exercise spaces. Physical activities comprising of table tennis, stretch and strength training, tai chi, pickleball, chairlift, and gentle fit flow yoga accommodate a variety of fitness levels. I took part in some of the programs offered at SHOAL Centre, such as a chair fitness and stretch class, gentle fit flow yoga, and a balance booster class. I helped with the setup and takedown of the monthly seniors luncheon, one of my highlights of the practicum. During the meal, we assisted and encouraged the guests to socialize. There was music and a guest speaker. Rides to the center are provided, and the luncheons are free to older adults living in isolation who do not get out on a regular basis. Sing-alongs, bridge, and ukulele classes are examples of the many social activities at SHOAL. The case scenario I'm identifying in my practicum is conducting an environmental scan of informal caregiver support programs in Canada and around the world. This scan will provide information and ideas for program planners involved with developing and expanding a new support program for informal caregivers in the community. Using inquiry and analytical skills, I created a large binder of information from various organizations and government websites and categorized it into geographical areas. The material was mainly Greek literature, but I included journal articles from academic sources. There were many articles on the need for caregiver support, but very few on support currently in place. Another skill I used was basic human resources when I wrote a job description for a volunteer facilitator for an informal caregiver support group. I used the Beacon Community Services format to be consistent with other jobs at SHOAL and added the responsibilities and activities, skills, competencies, and qualifications specific to the job. I also wrote 6 additional interview questions pertaining to a facilitator position. Partnerships with people and populations served is one of the values that guided me in my Seniors Advocate of BC, the BC Association of Community Response Networks, and the Family Caregivers of BC. I participated in the Minds in Motion program offered by the Alzheimer's Society of BC, held at SHOAL Centre. SHOAL is also affiliated with the Better at Home program and the Chronic Pain Self-Management program. I learned that SHOAL Centre is connected to many organizations that support older adults in the community. The PHSP knowledge area that stood out for me was knowing how to improve health and reduce inequities in older adults in communities. Ensuring that older adults have positive social and life course determinants of health, such as housing, food security, health equalities, social support, and social inclusion through SHOAL's many programs and partnerships with other organizations is essential to their health and well-being. The call to action that resonated with me was number 22. We call on those who can effect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. In my practice, I will endeavor to focus on building trusting and respectful relationships with Indigenous clients. Positive relationships lead to clients learning about their health issues and how to practice health-promoting behavior, both in Indigenous ways and Western medicine. I will support and advocate for Indigenous peoples and collaborate with Indigenous healers and elders. I will be cognizant of any social or health inequalities and try to rectify the situation by notifying the appropriate authorities. The practicum allowed me to experience the operations of a busy community center delivering services to older adults. The staff at SHOAL Center is dedicated to support older adults and their families and friends. At SHOAL, I obtained a new understanding of older adults. Many of the volunteers at SHOAL are older adults themselves and donate a significant amount of work to the operation of the center. It is encouraging that older adults are living fulfilling lives and are still contributing to their community. Working with a staff dedicated to support older adults and their family and friends has been a positive experience. Their caring and willingness to help clients and co-workers is evident. I have learned many things and practiced some of the skills during my practicum, which I will take away with me and use in the future. The practicum was my highlight of the BA program. The highlight of the practicum was interacting with the older adults at SHOAL Center. I also enjoyed the week-long on-campus course where I met some of my classmates. Another highlight was learning about truth and reconciliation and cultural safety and competence. I would like to express my gratitude to the following people for their support. Glennis Cavers, my practicum supervisor, the staff and volunteers at SHOAL Center, Betty Taylor, Natalie Franston, all my instructors in the BA program, fellow classmates, and my family and friends. Thank you.